Happy new month. It is February, right? It's the month of love, and I wish you all the best this month. I pray that all your desires come to pass. If this is your first time watching me, welcome. Where have you been? Come on, join the family. You are welcome here. My name is Victoria. I'm a midwife, childbirth educator, birth coach, doula. I love everything pregnancy, labor, birth, all that good stuff. And so, if you are interested in anything like that, go ahead and hit that subscribe button, turn on the notification bell so you don't miss any of my videos. I upload once a week and I come live on Sundays. As of right now, I hope to share more videos weekly. But for right now, we're having 2 videos per week, a live video and a video once in a week, a pre-recorded video. So if you're watching this, let me know where you're watching from, even if you're watching on a replay. I love live videos because you can come on here and answer questions live, and you can have your questions answered live. All right? Today, I'm going to be talking about some common breastfeeding questions. I've been teaching some classes, and I see there are some common questions that I would like to talk about and answer today. So, are you currently breastfeeding? Let me know what are the good things and the not so great things about breastfeeding in the comment section. Alright? Share your experience so that other moms can also learn from it. So, what is breastfeeding? Why breastfeed? Breast milk is the best for your baby. It is called liquid gold. We like to call it liquid gold because it is cheap, reliable, and affordable, right? It is cheap, reliable, affordable. It's also like medicine for your baby. So it's the best for your baby, all right? The first question I'm going to answer, and I'm looking at my computer right here because that's where the questions are. It says, is it normal to have a small amount of colostrum? So what is colostrum? By the way, if you have any questions for me concerning pregnancy, breastfeeding, anything like that, go ahead and leave it in the comment section and I will try to answer it in our next live next week or when next week coming live, okay? And yeah, we'll do that. So now, what is colostrum? Colostrum is that first milk that comes out when you give birth to your baby. Sometimes, for some women, you'll start to see colostrum even before you give birth to your baby. Let me know if you're in this group, if you can relate to that, all right? By the way, guys, so sorry if you can hear background noises. I'm just here, and there are lots of just people going by. But I'm sure you can hear me. If you can't hear me well, let me know in the comment. So yeah, colostrum. Colostrum is great for your baby, even though it might seem little. It is enough for your baby because in those few first days when your baby is born, the colostrum is great. It's liquid antibiotics. It's like antibiotics for your baby. It helps your baby fight infection. Maybe not just antibiotics. It has antibodies. That's what I'm trying to say. It has antibodies in it that helps fight infection. So no antibiotics like the medication, but colostrum has antibodies in it that helps fight infection. All right. The other thing is it normal to have a small amount? Yes, it is normal to have a small amount of colostrum because your baby's stomach, let's start from there. It's very little when they are born. And that's why we advise that you feed them often, right? When they are born, because their stomach is little, so whatever they eat, they will digest it quicker. So you don't have to worry, just feed them the colostrum. It's normal that it's little. And in around 3 days-ish, your your breast milk will come in, your full breast milk will come in, all right? Okay, and of course, the color of colostrum, it's usually around yellowish. So let me know if you can relate to colostrum, feeding your baby colostrum. Let me know in the comment section, all right? Let me check my comment right here. Okay, good. All right, we're good. Now the next question says, will I have enough milk for my baby? Will I have enough milk for my baby? Hello, welcome, welcome. I see there are people here. Please give this video a like, thumbs up. Let me know where you're watching from. And if you have any questions about breastfeeding, pregnancy, go ahead and leave it in the comment. Even if you're watching this on a replay, all right? Okay, so will I have enough milk for my baby? The answer is yes. Breastfeeding, breast milk works like this. Supply equals demand. So the more you supply to your baby, the more your body knows to make more. So don't feel like, oh, I need to save the rest of the breast milk for later. No, no, no. Make sure you feed your baby as much as they want. And if you're planning to pump, go ahead and pump, because pumping helps increase your supply. Because your body tells your body to produce more if you're giving more. You understand what I'm saying? Your body tells your body, as long as the baby is sucking and you're pumping, it tells your body to make more milk, all right? Let me know if you pumped milk for your baby, and let me know how that experience was for you, all right? So the answer is yes. Yes, breast milk, breastfeed, breastfeed, breastfeed. All right, so the next question here is breastfeeding painful? And this is really kind of like sad, because some moms feel like it's okay for a breastfeeding session, you know, when you're feeding your baby, that it's okay for it to be painful. And no, no is the answer. It should not be painful. If it's painful, you probably need help. And it's okay to ask for help. Why? Because you and your baby, especially if it's your first baby, or if you've never been successful to breastfeed your baby, get help. There are people that are trained for this. There are lactational consultants, there are lactation counselors, there are midwives that can help, there are doctors that can help. So please do not stay in your area alone. Ask for help, all right? All right, if you're here watching replay, let me know where you're watching from. Please leave a comment. It helps the channel out, and give this video a thumbs up. And also make sure you share so other people can find this video helpful. And if you have any questions about breastfeeding, go ahead and leave it in the comments, all right? Okay, so the answer is breastfeeding painful? No, it should not be painful. Of course, initially you could feel a bit of discomfort, right? A bit of discomfort, but as you learn, as you feed your baby, it should go away. And I want you to notice that when you breastfeed, your baby should not just take your nipple, all right? It should, he or she should be latching on the areola. The areola is the blackish part or the brownish part of your breast. So we have the nipple, which is the tip, right? And then you have that darker part, that's the areola. That's what your baby should be latching on, all right? If they are latching just on the nipple, that would be painful, all right? So make sure they're latching on well, make sure they're getting the whole thing in their mouth, because their tongue and their gum would help massage your milk duct to get the milk out, all right? Yeah, let me know if breastfeeding was painful for you, and if you got help with breastfeeding. All right, I see some people here. Make sure you let me know where you're watching from in the comment. We're so happy to have you here with us. And if you have any question, leave it in the comment. I'll be reading it live, okay? Okay, so the next question says, I'm reading from my computer right here. It says, if I use a breast pump, how long can I store my breast milk? If I use a breast pump, how long can I store my breast milk? And this is a very common question. I would say that if you store your breast milk in a regular refrigerator, it should be able to stay around 5 days, okay? Around 5 days. If you store it in a standard freezer, a standard freezer. It should be able to stay around 3 to 6 months, all right? And if you store it in a deep freezer, it should be able to stay around 6 to 12 months, all right? 6 to 12 months. Let me know in the comment section if you stored breast milk for any reason. Maybe you have to go back to work, maybe just for your husband to be able to also feed the baby and you can rest, you know, for them to bond together. Let me know some reasons why you decided to pump and also store your breast milk, all right? Let me know in the comment section. So yeah, that's the answer. And then the other thing is, when you take your milk out to thaw it and give it to your baby, note that you cannot leave it for more than 24 hours because it will not be nice, okay? All right. If you're watching this, make sure that even if you're watching on a replay, if you have any questions about breastfeeding, leave them in the comments. And if you're interested to take my course, my childbirth education course, make sure you actually send me a DM. That would help. Send me a DM in my Instagram or in my email, and we'll get that started for you. All right? Now, the last question I'm going to take today says, how long should I breastfeed? How long should I breastfeed? I love this question. So AAP, which stands for America Pediatrics, AAP, yeah. America Academy of Pediatrics, excuse me. America Academy of Pediatrics. So pediatrics are baby doctors, right? Children doctor. They recommend that you should exclusively, the word is not coming out, exclusively breastfeed for at least 6 months because it's best for your baby, all right? And then if you want to do more, it's great that you do it for a year. And of course, until you and your baby want to stop breastfeeding, all right? There's nothing that says that there's nothing bad in breastfeeding for longer, but the recommendation is at least 6 months, all right? Okay, so that brings me to the end of our question today. If there's a topic you'd like me to talk about in our next live, let me know in the comments. And if you're watching this on a replay, let me know where you're watching from. Let me know which of these questions you had, and if the questions were answered in the way you wanted it, and if this was helpful. Do not forget to share this with someone, and I'll see you in my next video. Make sure you catch the video I shared last week. It was about pregnancy, yes. It was about pregnancy, so make sure you watch that on my channel. And I have a new bright video coming on Tuesday this week, so stay tuned. Thank you so much for coming to watch. I really appreciate you guys. See you in my next live. God bless. Love you. Bye.